There are many ways to use marijuana, and depending on whether you inhale THC or ingest THC, the effects can be very different. With inhalation, the effects normally last about 3 hours. Whether you smoke or vaporize, the delta-9 THC enters your respiratory system through your mouth. It then flows down through the trachea or windpipe, and then into the lungs. The delta-9 THC then passes from the lungs directly into the bloodstream. In the bloodstream, the delta-9 THC travels towards the brain. Before anything can enter the brain, however, it meets a protective blood-brain barrier. To protect the blood-brain barrier only allows certain molecules to pass through to the brain. With delta-9 THC, only a portion of the THC can cross the blood-brain barrier into the brain. The onset of the effects of inhalation of delta-9 THC is fairly rapid because it passes directly through the lungs into the bloodstream and into the brain, and the effects normally last about 2 to 3 hours. The effects of ingesting cannabis edibles, however, last much longer, often 6 to 10 hours. The effects of the ingestion of cannabis edibles also take much longer to take effect. You should always wait at least 2 hours to judge the effect before eating any more. The reason for this delay in feeling any effect is due to the route that the cannabis must travel through the digestive system. Ingestion of THC, of course, starts in the mouth when you eat a cannabis edible. The swallowed THC then travels down through the esophagus to the stomach. Digestive enzymes in the stomach then begin to metabolize and break down what you have swallowed. The process then continues as the delta-9 THC passes through the small intestine. Blood flowing from the wall of the small intestine then carries the delta-9 THC to the liver. In the liver, the delta-9 THC is metabolized into another form of THC, 11-hydroxy-THC. The 11-hydroxy-THC then enters the bloodstream from the liver. Through the bloodstream, the 11-hydroxy-THC then travels towards the brain. And as with delta-9 THC, the 11-hydroxy-THC then reaches the blood-brain barrier. To protect the brain, only certain molecules are allowed to pass through the blood-brain barrier. Unlike with delta-9 THC, the blood-brain barrier allows more 11-hydroxy-THC to pass through to the brain. This explains, at least in part, why the effects of ingesting cannabis are much stronger and much longer lasting than with inhalation of cannabis. For medical marijuana patients especially, ingesting cannabis can be much more effective than inhalation. If you're using cannabis to control pain, for instance, ingestion may get you through the night pain-free, whereas inhalation may only give you relief for 2 or 3 hours. With ingestion of cannabis, it's very important to always start low and go slow. Take just a small amount of an edible and wait at least 2 hours to see how it will affect you before eating any more. For this and any other information about cannabis, please visit my website at www.cannabisguru.ca.